Good afternoon, bon après-midi à tous. Thank you for joining us for today's special media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Avant de commencer, before we begin, a few reminder items. Please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery, and that button is located in the top right corner of your Zoom screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez aussi changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de l'écran. Reporters with accessibility needs can pin Annette, the ASL interpreter, or follow along on the YouTube stream. Nous aurons prochainement notre interprète Micheline LSQ qui sera disponible à épingler sur votre vidéo ou en direct sur YouTube. Today, we will be hearing remarks from Dr. Vera Etches, Chief Medical Officer of Health at Ottawa Public Health. Also on this call is Marie-Claude Turcotte, Program Manager of Immunization at Ottawa Public Health, who can answer specific questions on this season's flu campaign. Nos porte-paroles aujourd'hui sont la Dr. Vera Etches, médecin-chef à Santé publique de Santé publique Ottawa. Aussi présente est Marie-Claude Turcotte, gestionnaire du programme d'immunisation en Santé publique Ottawa, qui sera en mesure de répondre aux questions reliées à la vaccination contre la grippe cette année. Je passe donc maintenant la parole au médecin en chef de santé publique. Please go ahead, Dr. Etches.
Hello, bonjour, Quay. Today, I think it's important to talk about what we can do in our daily lives to help slow COVID-19 in the community. So when we go into a grocery store, a public place, we are protecting each other by wearing masks and staying 2 meters apart. When we go to school, we use the same precautions as much as possible. And these measures are helping us keep our local economy running and our schools open, while also protecting essential workers who may have the greatest risk. However, data collected during our case management process is indicating that we also have some significant blind spots. Some of the blind spots are occurring in situations which are not covered by provincial or municipal regulations, such as the crowd gathering limits or mandatory mask bylaws. So today I'm encouraging everyone to check your blind spots, Les données de gestion des cas indiquent que nous avons également des angles morts considérables. Certains des angles morts sont présents dans des situations qui ne sont pas visées par les règlements provinciaux ou municipaux, comme les limites de rassemblement et les lois sur le port obligatoire du masque. Aujourd'hui, je vous encourage tous à vérifier vos angles morts. So one blind spot is gathering with extended family and larger friend circles and thinking that the risk of COVID-19 isn't there. Another one is socializing before or after a team sport, or grabbing a ride to or from a sports practice without wearing a mask. Transmission of COVID-19 will occur in any setting if given the opportunity. And the risk is there whenever people are less than 2 meters from each other and not wearing masks. Dans notre communauté, y compris à la maison. Ce sont nos actions et nos comportements individuels qui influencent la propagation, quel que soit le contexte. So every day, as we go about our daily routines of work and school, socializing, and errands, we need to continually keep assessing the risks. Is this activity safe? Could I be exposing myself, my family, my coworkers, my friends, my schoolmates to COVID-19 if I share a meal with people outside of my household, or visit a loved one or hang out with a friend without physical distancing? Can I do this activity in a safer way? This week, Ottawa Public Health released the latest results of an online survey asking the public about their experience in the pandemic in stage 3. And among the survey results, which can be found on our Engage Ottawa website, we found that 89% of residents said they are supportive of the temporary mask bylaw because masks are effective in reducing transmission and they're an easy individual action one can take to protect others from COVID-19. However, Ottawa residents said it is challenging to maintain a social circle of 10 people or less that are exclusive to each other for many reasons, which included large families, and having children in school. So I want to tell you, I hear you. You are doing difficult work every day. And I also know from the survey results that you're doing many things to stay positive in these challenging times. People reported doing physically distanced and virtual conversations with friends and family. You're keeping active and focused on your mental health. And these are important actions and strategies that will help us get through the weeks and months ahead. I also want to remind residents that anyone with symptoms of COVID-19 is advised to seek testing, either through booking online or by phoning for an appointment. The assessment centers have appointments open every day of the week and the capacity to see more people. Je tiens à rappeler aux résidents qu'on demande à toute personne présentant des symptômes de la COVID-19 de se faire tester en prenant rendez-vous en ligne ou par téléphone. Les centres d'évaluation offrent des rendez-vous tous les jours de la semaine et ils ont la capacité nécessaire pour voir plus de gens. So also, we're encouraged by the strong demand for the influenza vaccine this year. Last week, residents started booking online appointments at one of Ottawa Public Health's 6 community flu vaccine clinics, with nearly 10,000 people obtaining an appointment the first week. And that is going to open up every Thursday. There are the opportunities to continue booking appointments week by week, Thursday starting at 9 in the morning. De plus, nous sommes encouragés par la demande publique du vaccin contre la grippe cette année. Près de 10 000 personnes ont obtenu un rendez-vous à compter de jeudi. D'autres rendez-vous pourront être pris en ligne jeudi à partir de 9 heures. So residents can continue to book their appointments at ottawapublichealth.ca/flu, or you can call our contact center 613-580-6744. And our clinics will continue to run in the evenings, 7 days a week. You can make an appointment with your family doctor also if they're doing flu vaccines, or by visiting a pharmacy. So finally, I'm counting down the days to Halloween, and I want to wish all parents and children a safe and happy Halloween. We might be celebrating in a very different way, but I'm sure we'll be making some good memories of a new way to have a healthy and safe Halloween. So thank you. Merci. Miigwech.
Thank you, Dr. Etches. I will now invite each agency in alphabetical order today to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique aujourd'hui. Chacun pourra poser une question et une question de suivi. Again, we have Marie-Claude Turcotte available for flu questions. Marie-Claude Turcotte est aussi disponible pour répondre aux questions reliées à la grippe cette année. Alors, la prochaine question, 104.7 Outaouais. Yannick Saint-Denis, c'est à vous.
Oui, bonjour, bonjour, Dr. Etches. Ma première question est concernant un peu les angles morts. Est-ce que vous pouvez redéfinir un peu ce concept-là? Est-ce qu'on parle ici de zones grises, de règlements qui ne sont pas très clairs ou plus difficiles à respecter?
Je peux donner d'autres exemples des angles morts, peut-être, parce que c'est difficile d'avoir un règlement qui identifie tous les risques dans notre vie. Par exemple, maintenant, nous avons les règlements concernant l'ouverture des restaurants et bars. Et peut-être ça reste les idées que le risque n'existe pas dans d'autres domaines comme une 5 à 7 avec collègues ou dans les salons des employés, quand on partage une auto ensemble sans masque. Il y a plein d'autres exemples qui n'est pas exactement réglé, mais c'est pour nous d'avoir une approche où on pense à le risque chaque fois qu'on est proche aux autres, quand nous avons les contacts étroits sans les masques. Est-ce que ça aide avec le concept?
Oui, ça aide. Et parlant justement de rapprochement, vous avez parlé aussi des restaurants présentement du côté d'Ottawa, malgré une zone rouge, les terrasses sont vertes. Là, on voit des terrasses qui sont couvertes aussi et chauffées. Donc, c'est pratiquement à l'intérieur. Et il y a aussi des Gatinois qui traversent. Est-ce que ce n'est pas un concept présentement qui vous inquiète? Est-ce que c'est une situation qui pourrait changer? Je sais que c'est peut-être plus une réglementation provinciale, mais présentement, quand même, il y a des rapprochements, disons-le comme ça, du côté des terrasses et des gens de Gatineau également qui traversent de l'autre côté pour aller profiter.
C'est certainement une période difficile pour les restaurants et les bars. Et je comprends, il veut utiliser les terrasses. C'est un problème quand il y a une terrasse avec 4 murs. C'est important d'avoir un échange de l'air et la ventilation comme dehors. Ça réduit le risque. Quand les gens sont là près aux autres sans masque, on a besoin d'avoir 2 murs ouverts pour aider avec la ventilation.
Merci.
Merci. The next question will be 1310 News. Alex Gouge, please go ahead.
Hello, Dr. Etches. So with Halloween this weekend, you've made your stance very clear on trick-or-treating, but it also is more of a party holiday, if you will, for adults. So more specifically, with looking at the blind spots, could you comment on how people should handle partying this Halloween?
Yes, so certainly what people should do is have fun in terms of dressing up and sharing your costumes with others, but you need to do it virtually if you are thinking of including people outside your household, right? So right now, I actually, it hasn't come up yet. I want to say congratulations to people of Ottawa. There's some encouraging indication that we're having some success with decreasing the level of COVID in our community. The rapid rise in cases, in people testing positive that we were seeing, 2 weeks ago has changed. And so I want to encourage people to do what has been making a difference, which is limiting our contacts with people outside our household. So sharing videos, sharing pictures, connecting with Zoom, with WhatsApp, different ways to connect virtually. Certainly, I think I see a lot of creativity happening in my neighborhood. People have started doing kind of tagging each other by dropping Halloween packages to homes with children, and then encouraging others to continue on with that practice. So I think there's different ways that are lower risk that involve distance, so you're not coming into close contact with somebody else. Decorating the homes. I think I'm expecting to see some great decorations out there again. People, it's safe to walk by and look at the decorations if you're not with people from outside of your household, those kinds of things.
And for my follow-up, just on a different note, the COVID-19 water sewage levels, they've been almost on par with the case numbers until within the past week, where the cases have haven't had a dramatic rise, but the numbers in the wastewater still are and continuing to increase. Could you please comment and clarify that as why?
Yes, so I don't have any definitive answers, except I can speak to the different sources of information, where they come from and what they can be telling us. So the wastewater shows that we had a peak at the beginning, I would say about 2 weeks ago, that beginning in October, we started to see a steep rise in the level of COVID showing up in the wastewater. And then about 2 weeks ago, that started to come down, and then it's gone back up a bit again. So this idea of the COVID being slowed down is there, the data suggests, but it's not dropping down to the low enough level that I'd like to see for us to avoid outbreaks in long-term care homes, for example, in hospitals and others. where unfortunately we're seeing deaths result. So the wastewater shows that we're stabilizing perhaps at a higher level. We'll have to keep watching the trend, in terms of it going up and down at a higher level. The numbers testing positive, you're right, they are more trending downwards more consistently. And that's people who present at assessment centers, who have symptoms or who are identified as contacts of people who test positive. And so that data source, does depend on people presenting for testing, and contacts also coming forward after that period of exposure to be tested. So it can take longer for the testing numbers than the lab has to process the test for us to see the change. The wastewater information is usually the earliest indicator of what's happening.
Thank you so much for your time.
Thank you. The next question will be CBC Ottawa. Joanne Chianello, please go ahead.
Hi, thanks. And I'm sorry if I wasn't muted before. I apologize. Dr. Etches, I'm asking for a colleague. There is a gentleman who owns a personal training facility, I guess I'll call it, a small business called A Foot Above Fitness. He says that he doesn't feel he is a gym. He feels he is a personal service business, and insists on being open despite having 3 fines. And I'm wondering what you say to him or people like him who feel that they should be open and insist on being open. I think we've seen this in Quebec too, where some businesses are saying, despite what the province is saying, we're going to be open. Do you have any thoughts on this or any actions you're taking on this?
Well, yeah, so my initial thought is, this reflects how challenging it is for businesses right now, especially gyms, restaurants and bars, and the actions we're seeing where people are taking steps to try to stay open when it's not clear that they should be open. That shows you how difficult it is for businesses to continue and survive, and that's challenging. That's challenging to the health of our community too, and individuals in that sector. So I think what we want to do is to continue the dialogue with the province about what's needed past the 28 days. What are the measures that can decrease the risk of COVID transmission while trying to keep as many businesses open as possible. And I think that's a good way to think about it. Like, how can you decrease the risk if certain activities, certain sports, if things need to continue, how do we do it in the safest way possible? So I would encourage businesses to be bringing those ideas forward of how to reduce the risk in higher risk settings like gyms. And I don't really know the specifics of this person in terms of I'm not involved in enforcement action and in determining whether someone is following the bylaws or the regulations or not. Always open. Okay. If people want to write to me directly with thoughts, that's fine.
Yeah, and this isn't my follow-up, but just so it's not that you're writing a Section 22 to close this business or anything that you know of. Okay, but
we're following the direction in the provincial regulation.
Right. So the one thing then I ask, of course, because he's not supposed to be open, but that does segue into my next question, because we heard the health minister at the 1 o'clock briefing say, yes, the numbers in Ottawa are coming down, but there's concern about long-term care outbreaks. You said it yourself that there's some good news. It's not completely across the board. There's a lot of different indicators. So next week is the 28 days are coming up. So what are you recommending, or at this point, what do you think you might recommend to the province of what they do at the end of those 28 days?
Well, certainly we are trying to come to some recommendations based on our data, based on what we know are higher risk activities, and we haven't got there yet in terms of we want to continue to see what the information is telling us. We're always looking at what happened 2 weeks ago when we talk about our case and contact information that's collected. But taking a look at, the blind spots that I spoke about today, taking a look at where we see the transmission happening, it does seem to be things that are under our individual control. There are things that our individual actions can change to decrease the risk. And so I am interested in an approach where we can focus on what helps us do our part so that businesses can open as much as possible, and what other kinds of ways can we approach businesses that might be higher risk to decrease that risk. So I think the idea that most of the transmission is happening when people come in close contact with somebody from outside of their household, that's how it starts and gets introduced into household. That's what we all need to focus on, and we can each do our part. Again, I think we've seen some progress, and I just want to encourage people to continue to do their part. I mean, there are populations that face greater barriers to staying home when they're sick, or being able to access support. So some of that work is very important too, and we've been talking to the province about how we continue to provide supports to people who are negatively impacted. Need to look at everyone being able to be doing their part.
Yeah, and thank you. I know that some people feel it's unfair that gyms are closed when there's no outbreaks, but then there are lots of outbreaks in sports teams, right? But those are still allowed. So I think people are struggling with that. So thank you very much.
Thank you. The next question will be from CTV Ottawa, Ted Raymond. Please go ahead.
Hi, good afternoon. I guess my first question will be just about these blind spots. Maybe you could, Dr. Etches, elaborate a little bit on if you have any numbers in terms of maybe percentages or a ratio of how many transmissions or what the level is of transmission in these blind spots compared to things like long-term care home outbreaks or at businesses or things like that, things that are regulated versus things that are not.
That's going to be hard for me to give you a quantitative answer just right now, but we can follow up, in terms of looking at what's available. So we know that anytime somebody comes within close contact, that's where there's a risk of transmission, and so we're seeing it happen. And I guess what we're seeing is that people don't think of these settings like carpooling or meeting up with extended family in the same way as a risk, in the same way that they might, in terms of going to a gym or going to a bar. And so we're just trying to expand people's risk assessment to include that it really is anywhere that you're within 2 meters of others and not wearing a mask. And certainly employees having lunch together seems to be something that comes up over and over again, and as a source of outbreak, whether it's in a healthcare setting or a school or a workplace, and so it's this idea that when we're with our colleagues, when we're with people that are our friends or close to us, we relax and it's okay, the risk can't be there. That's just not true. It is what gives the virus an opportunity to spread. And I just want to go back to say this is no one's fault. This is a virus that is often present when people don't know it, right? People are asymptomatic. When people have very mild symptoms they don't realize could be COVID. That's why we need the distance between each other, and we need to wear masks. And so the lunch is particularly challenging because people take off their masks to eat. And if you're in close contact, that's a risk, even when it's your colleagues. So I just think that's something that's occurring more than it should be.
Okay, so that's thank you for that. I do have another question just in terms of testing, because I know that that's one piece of the puzzle in understanding the spread of this virus. in the city, but we've routinely been seeing from the testing task force that the labs aren't really meeting their targets. They're giving us a target of around 4,000 some odd tests a day, and they're at or just a little bit above half of that. Do you know, is this a case of just still lacking in resources or people, or what is really kind of holding up testing in Ottawa and leading to still seeing some backlogs sometimes in over 1,000 people?
Yeah, I don't. I thought I have to look at the numbers you're looking at, because I don't see a very significant backlog in the tests now. We're at about 80% of tests are turned around within 48 hours. So it's sometimes the flow of the samples. You know, they come in each day. You know, and so that it's not really so much of a backlog as a flow that they're getting to the next day's sample each day. You might be looking at something different that I'd have to see. The testing capacity is there. I guess that, you know, we don't have a problem right now with the staffing for the assessment centers, and the laboratories are able to handle the amount that's coming in. We do have 2 labs that serve our region. One is the Eastern Ontario Regional Laboratory Association, and the other is the Public Health Ontario Lab. So it could also be that sometimes one of the labs is called on to process samples from outside the region. If the capacity exists here, they might ask us to help with the backlog across the province. So on the testing overall, I think that we've seen the benefit of the provincial changes to focus on people who have symptoms. The pragmatic approach around children with just a runny nose don't have to be tested before they go to school. Like there's other ways to manage that and assess that. I think it's given us the ability to have spots for people to present for testing without delay, and for the labs to better manage.
All right, well, I appreciate that. Thank you.
Thank you. Next question, Global News from Craig Lord. Please go ahead.
Thanks very much. And I'll just go back to maybe one of the questions or one of your responses you were saying to Ted there about lunches and workplaces being a spreader. Obviously, going back to the workplace and that social connection has been one of the things I think people have been missing the most in the pandemic. So just wondering if you have any specific guidance that you can pass on to workers and to their workplaces, their employers, about how to socialize safely in those lunchrooms or in those water cooler chats that people were probably missing a lot during the more severe lockdowns.
Yeah. So if you're meeting up with colleagues and you're indoors, wear a mask. And then that's why lunch is a challenge, because you have to take off your mask to eat. So during lunchtime, keep distance. Make sure that you're distanced at least 2 meters from others while you're eating your lunch. But certainly, indoors, can connect with people. Just wearing those masks is the added level of protection that will help keep the virus, to yourselves and not spreading.
Yeah, and going back to something we were talking about a little bit earlier, that you're congratulating Ottawa on doing an effective job of seeing those cases go down, but we have seen other hotspots in Ontario where cases are still rising. I'm just wondering, from your perspective, what is the difference in Ottawa, and have you seen any specific differences in the advice that maybe you give versus your counterparts in Toronto or other regions? Where do you see the difference in Ottawa's handling of it?
That's very hard for me to answer. I'm not so familiar with other jurisdictions in terms of their challenges or successes. I do know what turns the virus around is when more people are keeping distance and wearing a mask and staying home when they're sick. So I think I just need to acknowledge that this is hard work to continue. It's impressive. People have maintained these kinds of things for months, and we're going to continue finding new ways to connect. I'd have to go back. I think maybe before the provincial regulations to have a modified stage 2 happened in Ottawa, Peel, and Toronto, we did have messaging in Ottawa to try to go back to limiting your contacts to your household. So that message of sticking to your household might have come out a little bit earlier, and emphasizing that might have started some of the turnaround as well.
Yep, thanks very much.
Thank you. La prochaine question sera du journal Le Droit, Julien Paquette. Ça sera à vous.
Merci beaucoup. Dr. Etches, un peu plus tôt dans la conférence de presse, vous avez mentionné deux choses. D'abord, qu'il y a des indications que la situation s'améliore. Et en même temps, vous avez indiqué que les causes de propagation, de transmission du virus semblent être un peu les mêmes, semblent être des éléments qui ne sont pas nécessairement liés aux pratiques de certains commerces en particulier. Donc, est-ce que le message a changé, en fait? C'est ma question. Est-ce que le message qu'on avait il y a presque un mois de limiter nos contacts aux gens avec qui on habite, est-ce que ce message-là a changé depuis dans la dernière semaine?
OK. Je pense que mon message de garder vos contacts étroits jusqu'à les membres avec qui on a habité, ça c'est le même pour le dernier mois, je pense. Mon message n'a pas changé, que le risque existe quand on est entre 2 mètres aux autres et sans masque. Il y a des risques dans les restaurants et les bars et les gymnases et d'autres lieux quand on est là avec les membres dehors notre foyer parce qu'ils ne portent pas des masques et ils sont à la même table. Ça, c'est un risque. Le risque existe partout dans les situations comme ça. Et je voudrais juste souligner que c'est pas le type des entreprises exactement, c'est notre action. Je pense que mon message était le même auparavant.
Parfait. Je me doutais que le message n'avait pas changé, je voulais juste le vérifier. Et ma deuxième question, c'est, vous avez répondu plutôt en anglais sur ce que pourrait être votre recommandation sur la réouverture de restaurants ou des salles à manger. Je comprends que vous n'avez pas encore pris votre décision finale là-dessus. La question, en fait, c'est est-ce que l'annonce d'hier du gouvernement du Québec de prolonger de 28 jours les fermetures du côté de l'Outaouais est un facteur dans la mesure où, il y a quelques semaines, vous avez indiqué clairement que vous souhaitez uniformiser vos messages avec ceux de la santé publique en Outaouais?
Oui, j'ai besoin de discuter la situation avec ma collègue cette semaine concernant le risque là et en comparaison de notre expérience à cet côté. Il y a toujours la possibilité de différentes approches dans les différentes provinces, mais l'idée pour moi, c'est de limiter le risque de transmission le plus que possible aux racines. Et pour moi, c'est le contact que nous avons dehors notre foyer avec les gens qui habitent dans un différent foyer. Ça, c'est la racine. Et si on peut créer une différente approche avec les entreprises, de réduire le risque, on verra. C'est une discussion avec la province, comment on peut continuer d'avoir un équilibre entre les différents défis pour la santé de notre communauté. C'est clair, c'est difficile maintenant pour les entreprises qui sont fermées et pour la santé de la population qui travaille dans ce secteur. Bien sûr, on a besoin de continuer notre soutien. Alors, on va discuter s'il y a une différence entre la vie dans les différents côtés de la rivière, comment on peut être clair, pourquoi, et communiquer avec les différents aspects.
Merci.
Merci. The next question will be from the Ottawa Citizen, Elizabeth Payne. Please go ahead.
Hi, thanks very much. This is a question for Dr. Etches. It's to do with hospital outbreaks. There have been outbreaks in hospitals throughout the pandemic, but during the second pandemic, there have been more deadly, more patients have died as a result of them. I'm wondering if you would comment on this and what it might say about how this wave is different than the first.
Yes, I think if you're talking about hospital outbreaks in particular, our overall experience is that with this second wave, it's a younger population that is showing higher rates of COVID infection, and so overall the mortality is lower because the younger population is more affected. And in fact, when we look at outbreaks in long-term care homes, we're also seeing less spread than in the first wave. So the outbreaks are coming under control faster, and they're more limited to often just to employees and not even getting to reach residents. So for hospitals, there's a different type of hospital in the list of outbreaks in the second wave. St. Vincent's is much more like a long-term care home in terms of the types of patients that are in the hospital. They are older and more vulnerable. So, that kind of outbreak can make things look like there's a higher mortality in the hospital. But you keep in mind, the hospitals are treating the most medically fragile people in our community, where, if we're going to see people die, that is more likely. So, I think the overall experience of the hospitals in managing people who arrive with COVID seems to be very similar. I don't feel the situation is more challenging in the hospitals as a whole.
Okay, thank you. I have a second question to do with wastewater again. Are there plans to use that data differently to do more specific testing that has long been talked about to sort of find out where there might be an outbreak coming, for example?
Yes, I know there's a lot of interest in thinking, for example, could we use this for surveillance in long-term care homes? Could we use this for surveillance in different, more, building by building? That would be very interesting. And I believe that kind of thing exists in research concepts right now. It's not something that is underway as an operation. But something that, again, people are trying these things out to see what is possible, and it may evolve into something more widespread.
Okay, that's not coming anytime soon. Yeah, thanks.
Thank you. The next question will be from the Ottawa Sun, Taylor Blewett. Please go ahead.
Thanks so much. So we continue to hear questions and concerns about the rationale for imposing the current modified stage 2 restrictions, as far as the evidence for targeting the businesses that have been impacted. I know the health minister said today that, this was something you were willing to have put in place here. So I'm just wondering if you can explain kind of your rationale at the time for giving the province the green light to go ahead with these restrictions. And would you say that they have been directly responsible for the reduced case numbers that we have been seeing for the last little while?
Yes, so, this is a virus that changes, and the situation changes so quickly over time. And so what we need to do changes over time. So I think back at the end of September, beginning of October, my advice was to try to stick to our households, to do our part to limit the transmission. And then we saw over the first couple of weeks of October, a real rapid rise in the level of COVID in our community. And so when the province indicated, that this step to reduce transmission by targeting businesses that we know have posed a risk across the world, right? Like there's maybe not always data, like we don't have a lot of outbreaks that we can point to in Ottawa, but we know the setting poses a risk. Then that is because of the gathering that happens with people across different households where there's no masks and there's close contact. Then that made sense to me, that the province would want to be able to do something that would turn that curve around, that it was getting high rapidly, was affecting our outbreaks, our hospitalizations had gone up. And so, now we're in a period where I do think that it's possible the closures have made a difference of the restaurants and bars and gyms, because I also look at where the rate of COVID in our community has come down the fastest. It's in people in their 20s, who are more likely to go out to bars, for example. And so, there is a possible contribution of the closures. And yet there's other things contributing, right? It's each of us doing our part to stay home or limit our close contacts. And so, there's not one thing that would have made the difference, but it adds up as we overall get fewer contacts between each other. And so, now we're looking at what can we sustain? What can we do for the longer run to be able to continue to drive COVID lower in our communities, because the level is still too high to avoid the number of outbreaks that are showing up. And so that's the next point of conversation.
Thanks, and that works perfectly for my next question, actually, which was, I was just hoping you could clarify, how much say do you actually get when the province will be making this decision now, at the end of 28 days, where we go from here? Like, is that something that, ultimately it's kind of up to you, and then they go on what you say, or just kind of take me into like that, what that process actually looks like?
So I probably don't know definitively, because I'm not part of the decision-making conversations, but I can describe what my understanding is, and I can tell you the province is very open to suggestions from public health units across the province, because we have data about our local areas, and we're doing case and contact management, and we're doing exposure assessments, and we're handling outbreaks, and all of that information is valuable to the province to inform what they think they need to tackle to decrease COVID. And at the same time, they have a public health measures table, which I think is where they get formal recommendations based on what they're looking at and what the science is saying. And again, I think they look at evidence around the world. So those recommendations will probably go the ministry to cabinet. I believe that then the government of Ontario would be making the final decisions. I have spoken to people in the Premier's office and the Minister's office, and they're very open to advice and inputs and ideas based on what we're seeing locally. So that is my plan, is to inform again, our provincial partners about what the situation is here and what we think will help us continue to live with COVID, to balance the different risks to the health of our community.
Thank you.
Thank you. The next question will be from, la prochaine question sera de Radio-Canada. C'est à vous.
Oui, bonjour. Ma question est pour Dr. Etches. Je voulais revenir sur le cas du gym qui est encore ouvert, dont Joanne vous parlait tantôt. Vous parliez des zones grises. Est-ce qu'il y a des zones grises dans cette industrie-là, dans les centres d'entraînement, les gymnases, pour les entraîneurs privés, par exemple? Est-ce qu'il y en a des zones grises où, selon vous, la réglementation est claire?
Je pense que j'ai besoin d'aide avec cet vocabulaire en gris. C'est quoi ça?
C'est les zones grises, the gray
okay.
areas.
Okay. Okay.
Les angles morts que vous avez mentionnés.
Oui, je pense que c'est difficile pour tout le monde de comprendre les règlements maintenant concernant les activités physiques parce qu'il y a les gymnases, il y a la danse, il y a différents aspects. Et oui, c'est pas toujours clair quels sont permis et qui n'est pas permis, les activités qui ne sont pas permis. Alors, ça, c'est probablement un aspect on peut discuter aussi d'avoir une approche plus claire pour l'avenir.
Parfait, merci. Et je vous parliez de l'Halloween un peu plus tôt, comment vous encouragez les gens à célébrer cette année. Le premier ministre Trudeau disait aujourd'hui que Noël risque d'être difficile, qu'il veut qu'on réduise nos attentes à l'approche de cette période-là. Qu'est-ce que vous dites aux résidents d'Ottawa? Est-ce qu'on doit s'attendre à ne pas pouvoir célébrer en famille cette année?
C'est pas trop tôt de réduire le nombre de cas de COVID-19 dans notre communauté avant les vacances en décembre. On a la capacité, on a les outils, on peut le faire et je voudrais encourager la population de utiliser notre outil de encore porter des masques, limiter notre contact étroit pour célébrer en décembre.
Merci beaucoup.
Merci. TVA Gatineau Ottawa, Kenza Belhadi, est-ce que vous êtes ici avec nous aujourd'hui?
Oui, je suis là. Est-ce que vous m'entendez?
C'est à vous.
Oui, je vais vous faire répéter un peu, Madame Etches, en lien avec ces fameux angles morts. Je veux savoir, est-ce qu'on a l'impression vraiment que c'est un gros problème dans la communauté, le fait qu'il y ait des gens, exemple, comme vous avez donné des exemples plus tôt, les 5 à 7 ou au travail quand on mange ensemble. Est-ce qu'on a vraiment l'impression que c'est vraiment un grave enjeu, on va dire ça comme ça? Et rappelez-nous, vous l'avez expliqué en anglais, mais rappelez-nous un peu les conseils qu'on pourrait donner à ces personnes-là qui, justement, peut-être ces actions qui ne sont pas couvertes par les règlements là, de la province. Qu'est-ce qu'on devrait faire? Comment, exemple, comme vous l'avez expliqué en anglais un peu plus tôt, là, lorsqu'on est au travail et qu'on mange ensemble, de garder la distanciation, les conseils qu'on a là, à ce niveau-là?
Oui. Nous sommes dans une pandémie et c'est difficile de vivre comme ça.
Une semaine, à peu près, on a parlé des éclosions au niveau des sports, des équipes de sport organisées. Est-ce que vous avez l'impression, je sais que ça fait seulement une semaine, mais est-ce que vous avez l'impression que le message est passé? Est-ce qu'on remarque un peu que les gens font un peu plus attention, qu'il y a moins de cas reliés justement à des éclosions dans ce milieu-là?
Oui, je pense qu'il y a beaucoup de travail de clarifier le message pour les différentes associations des sports. Et oui, le nombre des éclosions il n'y a pas beaucoup de nouveaux éclosions dans ce secteur. Alors, on va continuer avec l'idée que c'est possible de réduire les risques. On veut continuer avec les activités physiques pour notre santé, pour la période de l'hiver, de continuer d'apprendre comment on vit avec COVID. Et les messages sont qu'il y a certains aspects autour de l'activité qui donne un risque et il faut réduire le risque, par exemple, par éviter de partager un repas avec les membres d'un autre foyer, les choses comme ça. Et je pense, oui, le message était communiqué et j'espère on peut éviter plus d'autres éclosions.
Merci beaucoup, Dr. Etches.
Merci beaucoup et merci beaucoup à tous. Ceci conclut notre point de presse d'aujourd'hui. Thank you. That's all the time we have for today. Wishing everyone a wonderful Tuesday evening.
Merci. Thank you.